Healthcare's absolutely gotten out of control in the last several years. I work at a large aerospace firm with some of the best benefits available out there, and I've personally seen my premiums double over the course of the last 5 years, and my deductibles do the same, roughly doubling. So what I attribute it to is a lack of competition. I think when we are provided with plan options, we're giving one or two. That doesn't really drive competition. So from my perspective, I think what we've got to do is give citizens more options, allow them to shop across state lines, allow them to look at multiple plans, and then throttle the deductible levels, throttle the coverage that they're looking for, and give them more options and more variables in terms of the policy itself. For me, I look at the car insurance business, for instance, and a catastrophic car accident where there's loss of life or significant injuries. When you look at the bills associated with that, is similar to a large medical experience or a large medical bill to the average citizen. Yet we don't see our car insurance premiums in the $7,000 to $10,000 a year range like we do our health insurance premiums. So. The reason that's the case is because there are more options. We're constantly being pushed to look at different car insurance companies, and there's hundreds of car insurance companies out there rather than just a handful. So maybe for healthcare, maybe we need more green geckos offering us more options and being able to shop across multiple states. So. Another big issue for me when it comes to healthcare is taking care of our veterans. In the local district here in California's 25th district, we have some significant issues and challenges with the mental health of our veterans, whether it's folks from Vietnam or recent vets from Iraq and Afghanistan. But they have to drive, in some cases, 50 to 60, maybe even more, 50, 60 miles to get to a mental health expert. And that's a shame. And what the reality is that when you have to drive that far to get that kind of help, you typically don't go get the help. It's too hard. It's too much pain, and it ends up aggravating the problems that you're having. So, for me as a member of Congress, I would focus and prioritize getting those mental health services and experts up to our district that specialize in veteran issues, who specialize in PTSD. And frankly, it's not good enough to just allow our veterans to go to a local hospital. They need to be able to get the services that are tailored to their needs. And then for the rest of us who are not veterans, we should be able to have a lot of the scope and a lot of the services that are typically provided in an urgent care facility be made available in a local store or pharmacy, where they can give flu shots, they can treat us for basic colds and flus, and not have to inundate our urgent care and drive costs that way. So another big issue for me is healthcare is one of the few industries where when you check in, you don't get a quote, you don't get told here's about how much it's going to cost to have this service or this medication. In some cases, you don't get the bill for weeks, months after the fact, and usually it's not a good surprise. It's usually a shocking bill that you're looking at. So I would support legislation that requires doctors and services, as long as it's not an emergency type situation, to actually sit down with the patient, explain to them the cost implications, where does healthcare insurance kick in, what's going to be expected out-of-pocket expenses, and really allow the consumer to have a full eyes wide open picture as to what that medical bill is going to look like before they start proceeding with the service. So I think that's the critical key. So more competition, more options, full disclosure on pricing, and taking care of our veterans is critical to health insurance.